Health News is brought to you by Dynamic Physical Therapy. Call us today to set up a free 15-minute screening with a physical therapist.
More than 5 million people in the United States are affected by fibromyalgia. Fibromyalgia is a syndrome that affects a person's muscles and soft tissue, causing chronic pain, fatigue, and sleep problems.
To have a true diagnosis of fibromyalgia, you have to go to usually a specialist, sometimes a rheumatologist, and they're going to test certain points within your body to see, okay, side to side, is it tender, different points of pain throughout your body.
Many people who suffer from fibromyalgia seek to relieve their symptoms through medication and lifestyle changes. Physical therapists, like those at Dynamic Physical Therapy, can help ease fibromyalgia pain.
Now, a lot of times people have been dealing with it for some time, or they just haven't wanted to go get the diagnosis, or they have just put off going to the doctor, and those people can still get help because you don't need that true diagnosis in terms to come and get treatment. So if you're having problems going up and down the stairs, standing, getting in and out of the car, sitting for a long time, there's a lot of different things depending on where you're having the trouble that it's taking away from the function of what you can do day to day.
While there is no known cure for fibromyalgia, physical therapy can help relieve the symptoms. Physical therapists aim to help those suffering from fibromyalgia learn healthy habits and movement forms when doing exercises on their own at home.
I always encourage patients to really, when they start therapy, or if they're concerned about starting therapy, call the clinic, talk to a therapist, stop in, talk to a therapist, and say, okay, here's what I've got going on, and make sure that you're comfortable with who you're going to be dealing with in that scenario, because you can really get some really good benefit from it in terms of increased endurance, better tolerance to activities, less pain, sleeping better. There's this whole wide gamut that you can improve your function if you start to address some of those issues.
The benefit of physical therapy is that it allows a person with fibromyalgia to work alongside a trained professional who can design a case-specific treatment plan as well as track individual progress for best results.
The one thing I would say is I tell people, don't give up hope. Don't write yourself off. If your function is decreased, you can't work, you can't be active, you can increase your activity again. You just have to do it slowly, you have to do it smartly, have your physicians help, have a help of a physical therapist so that they can work through all the issues that will come about. It's not that, okay, this is where I'm always going to be, I'm not going to be able to do these things. No, there is, and it takes time and it takes persistence and, just hammering at it slowly over time. And that's where my job comes as a cheerleader to say, okay, one step at a time, hang with me. It takes 2 or 3 or 4 weeks to start to see some change, but you hang with me and we're going to make some progress.
With My News 26, I'm Kayla Kiley.